Good morning, Chairman Mills and members of the committee. I'm Melissa Flournoy, the board chair of Louisiana Progress Action. And I'm here today to support, I guess what I would say, my adopted son, Dylan Wagasback, the leader of Louisiana Trans Advocates, and to ask you to vote no on Senate Bill 104. I'm here today because Senate Bill 104 is unnecessary and will do more harm than good. And as I testify in committees, I generally think about four questions. What is the problem? Does this legislation solve the problem? What are the unintended consequences of the legislation? And is the legislation necessary? Let me explain to you what I know about young transgender people. I have worked with young transgender people for the last 11 years with Louisiana Progress. At Louisiana Progress, I've hired as interns or staff many transgender and LGBTQ young people to work on advocacy and policy research, communications, and to represent Louisiana Progress at the legislature. I've gotten to know and love these young people. They are talented, competent, capable, and really extraordinary and resilient people. This is when I act as a mother and I might cry. When I first met Dylan 10 years ago, he was a student. Oh my God. I didn't plan on doing this.
That's okay. We cry a lot too. That's all right. We're crying more than we should probably right now. Take your time.
Well, I'm feeling like John Boehner today. When I first met Dylan about 10 years ago, he was a student at LSU, just beginning his personal journey to become the talented man that he is today. I could not be prouder of him. It is not my place to tell his story, but I asked his permission to talk about his journey and the journey of others. Because based on my experience with these young people, I have come to learn their challenges that they've faced in their homes, with their parents, with their families, in their high schools, their colleges, and their jobs. I have come to take personal privilege to tell their story as I know it. I respect these young people. They are the experts on their own lives. They know what they know about themselves. All of these young transgender people that I know were fully aware of their status early in their lives. They may not have had the language or the medical terminology, but they knew. That's the point that I want to make. They knew. It does not matter if we know. We have to learn to listen and respect these young people. We need to provide opportunities for them to learn to talk to their families, counselors, medical professionals in an affirming, non-judgmental way. Many of these young people are coming from households where their parents, the understanding of themselves was not easy to communicate to their parents. Some parents are not knowledgeable about LGBT issues. Some parents panic. Some parents kick their children out of their houses. Some children are forced to be homeless. Some children are forced to leave school because of issues around acceptance by teachers and administrators. Some children are so misunderstood that they have depression and other mental health challenges, even suicide. We need to listen to these young people. They know what is going on in their hearts, in their heads, and their bodies. If anything, we need to focus more on mental health counseling for parents to understand their LGBT children. We need to help provide resources for families to understand what is going on with their children. We need to create resources in the community to support these children and their families. The efforts to limit access to counseling and health care for young people is wrong. If a young person identifies as transgender, we need to encourage an appropriate process of self-discovery, affirming counseling, education, and access to appropriate and compassionate health care. We need to protect all of the children of Louisiana, even the children that we may not know or understand what they are going through on their personal journey. The truth is that too many children are being raised in families that face many challenges: financial, health, education, employment, housing. Unfortunately, too many households include abuse, neglect, and mistreatment. Many parents are overwhelmed by real life and may not have the resources, experience, or knowledge to know how to seek the assistance to help an LGBT or transgender child. Unfortunately, too many families have ended in divorce. We have estranged parents and children. We have abusive parents. We have parents that are unable to grasp what their children are going through and overreact. I come back to the questions from the beginning. What is the problem? Young people need affirming counseling and medical care, and a support system of caring adults, parents, teachers, and healthcare providers. Does this legislation solve the problem? This legislation makes the problem harder to access affirming health care and requires the involvement of both parents regardless of their status as a custodial parent or not. This legislation creates unnecessary obstacles for families. What are the unintended consequences of this legislation? Is unnecessary involvement of state government in the private affairs of families, including taking families to court. This legislation is completely unnecessary. If young people live at home and are on their parents' insurance, then the parents are involved. Medical professionals have limitations on their practice with minor children, and appropriate parental notification requirements are already in existence. Let's support Louisiana families to access appropriate medical care. This bill hurts children and families. Please vote no on Senate Bill 104. Thank you.